Yes, you are.
Okay,
Yes.
thank you so much. So we are delighted to have with us Dr. Ravi Shankar. As we all know, he's the founder, CEO, and director of R&D. He's skilled in R&D, clinical research, animal models, AI, ML, and also has 4 patents. He was also the speaker at the E-Summit of IIT Bombay, and he's now here to share his experience and knowledge with all of us. Sir, the session is on you. You can go ahead.
Thank you very much, Siddhi. First of all, let me thank Rupak Banerjee, who'd been, chasing me, and really we were talking at least for the past 4 months, and on the LinkedIn, and I was invited to the IIT Hyderabad actually, it's through that, not Mumbai, but nonetheless, it's pretty much one of the world's most premier institutions. So I'm deeply honored and excited to be here today among you guys, a group of aspiring and innovative entrepreneurs. And, really, appreciate Rupak Banerjee and the IIT Gandhinagar ESL for inviting me to share my insights. Um, as I, dwell upon, I really don't know what to talk, but I'll definitely talk about the journey, the incredible journey that we had with Dr. Polly, this most advanced AI and ML form of a digital health platform that we created, which is really groundbreaking and taught me invaluable lessons about entrepreneurship, innovation, intersection of technology, healthcare, Ayurveda, and allopathy. The modern and the ancient science. So I'll quickly walk you through how we kind of started off, where it all started, and how we by the fusion of these two medical streams, the Ayurvedic and allopathic streams, which we recognized very early on on the fact that the future of healthcare would lie in essentially integrating the traditional wisdom, which comes with a load of experience of several thousands of years of practices of our country, of India in specific. I'm talking about Ayurveda, and then how we were able to essentially we understood that these both the streams, the modern science essentially, have to be integrated, and it cannot be done dogmatically. It should be done scientifically. That was the underlying, guideline that we stuck to ourselves. When it all started, it was 32 years ago, not today. Most of you, or if not all of you, must not have been born when we had started off this. But it was really, a very exciting venture. Let me share a couple of instances of how we realized the necessity of incorporating this ancient science of Ayurveda and integrated with modern science. And then how we were able to bring in really improvement in the clinical outcomes of several thousands of patients, across the world, not just in India. And how we were able to integrate technology, and then as of course, as we progressed, the uh, moving out of the borders. I mean, when you talk about taking a certain idea, a business idea out of the country, it definitely has to go through those regulatory frameworks and certain acceptance um, from the local populations. But this started off not in India actually. Though we're talking about the Indian ancient science, it started off in Russia, to be very frank. So it all started when I was in the third year of my medicine, when I mean, doctors are voracious readers. I'm sure most of you must be voracious readers too. At least you would go through certain scientific papers every now and then. So as a part of medical doctor's venture, I'm talking about year 1992. Uh, Stumbled upon a very interesting and a very scaring situation in which I figured that most of the modern drugs that we are giving As I said, that was the third year of my medicine, and most of these drugs were actually, causing a lot of side effects. Okay, by the way, this is again not a debate between which is better, Ayurveda or it is not Ayurveda versus allopathy. How both the streams put together, we could really, improve the quality of life. That's been our take-home message. But then I'll arrive at that slowly. But then it all started with this scary scene that most of the pharmaceutical drugs are having a lot of side effects. And one of the side effects was death. And I was really scared at the age of 19 when you're given to understand that one of your drugs that you're actually inducing or administering in your patient to actually save the patient has killed your patient. It's going to be catastrophic, and that really scared me. And that's when I started looking in to our own ancient sciences, and really, a couple of things really helped me get back into quickly understand the necessity of understanding Ayurveda. Because then I studied my schooling was done in Sri Sathya Sai school, so I was taught all these Upanishads and Gitas and everything right in my childhood. So we were really bombarded with all of that very important knowledge, but we really mugged up everything in Sanskrit, and we kind of not really understood everything, but then we kind of mugged up, and it really gave a different perspective. But then uh, one thing continuously came, our spiritual mentor had always been saying that Yanna Bharati Tanna Bharate. So what it means is whatever is not in Bharat cannot exist anything else. That was the kind of message that we were always taught. So I said, okay, let me look into if at all any books on health were written. Let me just get into those, deep dive into those texts, and then understand. I started reading them. I found Ayurvedic books. You know what? I found the original Ayurvedic Sanskrit books in the libraries of Russia. They were already translated into English and into their local Russian languages. That was really amazing because, we were, uh, uh, most of us at that time were not even, aware of, such books like, Maharshi Charaka Samhitas. Maharshi Charakas, it's called as Charaka Samhita, Sushrita Samhita, or even existing, But then the books not only found their way into those libraries, but then, they've done a lot of research on that. And then people around the world built medical concepts around that. And then that was really intriguing. But then when I started reading them, so if you look at the why do we have to, why is this problem of understanding the health in the modern perspective is still a problem today? It's because I'll quickly walk you through certain guidelines that we follow when we try to assess a person whether he's healthy or not. If you want to say a person is healthy, we run a battery of tests, and then those tests would you figure out certain values for your blood glucose, for your cholesterol, and then you say, okay, if this a certain values within the accepted reference levels, and then you say a person is healthy or not healthy, right? That's what we do. Everyone must be at least aware of it. So the interesting part is, or the confusing part is that if you say a person is diabetic, the question that should be asked is according to who are you diabetic? Because there is something called diabetes is a condition you all know, must have known at least. Diabetes is a condition in which the body doesn't metabolize glucose, and hence the blood glucose levels keeps rising. And because it doesn't metabolize glucose, you're not left with any energy, and so the patient feels very lethargic, very low on energy, and several other complications because of increased blood glucose, lead to damaging of the kidneys, the eyes, the heart, the end vessels, and several other problems come in because of that. But then the question is, according to who are you diabetic? Because there's another concept that your blood glucose level should be within certain level. And there's something called as an average blood glucose, which is the 3 months average, which is measured in the form of your glycated hemoglobin. The value should not be beyond 5.5 according to the American Endocrinologists Association. Now look, this is the very interesting part of the question. American Diabetology Association is saying that your HbA1c should be below 6.5. They're slightly liberal. They say, okay, you don't have to push it below 5.5. Let's stick it to, I mean, let's put it around 6 point. Now, the American College of Physicians is saying that your HbA1c actually should be between 7 and 8 and never below 6.5. This is very interesting, isn't it? Because two very strong bodies, and by the way, they're not just strong because of the money power that they have, but because of the data that they have. The American endocrinologists have come up with this number because they have data. They've done clinical trials with over 200,000 patients recruited. American Diabetology Association has recruited over 300,000 patient data, and then American College of Physicians is saying they've done a trial, which is called as ACCORD, ACCORD trial, and it says that their patients, when they had both diabetes and heart disease, when such patients' blood glucose was pushed below 6.5, which means when they were subjected to intense glucose lowering, they 1 in 3 who had this both heart disease and diabetes, 1 in 3 died. That's that's really scary because 1 in 3, 33% mortality in a certain contingent of people. And hence, American College of Physicians is saying it should be between 7 and 8, and because they provide data for that. The American Veterans Affairs Diabetic Association is saying it should be between 8.5 and 9.5. The question is, friends, according to who are you diabetic? Because everyone has their data, and the American Veterans Affairs has also demonstrated data that if their veterans are pushed, their blood glucose is pushed below 7, then at least 45% of them have serious side effects. Some of them experience hypoglycemia. Hypoglycemia is a condition in which your blood glucose lowers and you kind of, end up with deleterious effects of low blood glucose. And that occurs below 7, right? And I just mentioned what is the value that I mentioned about endocrinologists and diabetologists. It should be below 6.5 or 5.5, respectively. So, according to whom are you diabetic is the biggest question, friends. Not just diabetes, but also the cholesterol. Now, let me quickly summarize this. We all knew that, we have something called as good cholesterol and bad cholesterol. The HDL is the good and the LDL is supposed to be the bad. But did you know that your good cholesterol, also when it is in high concentrations, could lead to heart attacks? Even low bad cholesterol also is leading to heart attacks. Now, how do you essentially treat a patient? Because this is the biggest question today, friends. That is really, looking at the face of all the, general physicians, diabetologists, cardiologists, and these two, diabetes and blood glucose and blood cholesterol, amount to at least 60% of your diseases. And you know that India is the diabetic capital of the world. But the question is, according to who are you diabetic? Now, with this intro, there are several other problems. I don't want to go deep into that because this is going to be too complicated. Because the problem is really complicated. Because this is a part of my 545 hours of lecture for retraining MBBS and BAMS doctors. So I'll not go deep into that. But then suffice to say that, as you see, 60% of the world's diseases that originate either from dysmetabolism of glucose or cholesterol, we don't know the standards for. How do you fix that? We don't know. Really speaking, we don't know. I'm a cardiac surgeon, by the way. I'm also a naturopath and also an Ayurvedic doctor. So the Ayurvedic side of it is saying that if you kind of bring about a balance of three agents called the Vata, Pitta, and Kapha, there's a beautiful verse mentioned in the Charaka Samhita and also in the Sushruta Samhita. It goes like this: Samadosha, Samagnishcha, Samadhatu Malakriya, Prasanna Atma Indriya Manaha Swasthya Itya Vidiyate. Now, what it means is Samadosha, that when the three doshas of Vata, Pitta, and Kapha are in equal proportion in all of the 7 tissues and 42 organs, then the body automatically restores its, sets itself into a self-healing mode and literally restores your physical health, mental health, spiritual, emotional, and social health, friends. But the problem lies there is what the problem that is what is vata, what is pitta, and what is kapha. If you look at the original scriptures, they mention about seven properties attributed to vata. Vata is categorized by or characterized by ruksha, khara, daru, laghu, shita, and I mean, certain properties that really don't make any sense. This is what was going on my mind when I was reading these books, those times, because what do they mean? Vata means something that which is light. Laghu means light. Shita means cold. Daru means hard. And things like that. I mean, does it make any sense, friends, in the science of, I mean, I was a gold medalist in biochemistry. So I was thinking, I mean, there are 7 million chemicals, as mentioned in Harper's biochemistry, friends. And how do you try to balance something that is which is light, dry, I mean, which was making no sense. But then the knowledge of Sanskrit really helped me, friends, to understand them deeper, not go deep into that. But then suffice to say that this language of Sanskrit, I think, you will really appreciate. It's not just a single syntax-based language. There are 9 syntaxes, 9, which means we're talking about 9 libraries of grammar. Sanskrit has 9. Maybe if you talk about Hindi, there's the Vyakarana. Hindi Vyakarana is compiled in 1700 grammar principles. The Telugu Vyakarana is compiled in about 1600. It's called the Chando Vyakarana. Then the English grammar is compiled in Wren and Martel grammars, and then there are about 970 principles of grammar. But did you know that the Sanskrit is guided by over 200,000 grammar principles? 200,000. And they're classified into 9 different libraries, just like our Sergey Brin classified all the lists and directories into 26 libraries. Our Sanskrit is classified into the grammar is classified into 9 different libraries. They are the Indram, Aindram, Sandram, Shakalam, Shakadayanam, Kashakrasam, Kaumarakam, Paniniyam, and Saraswatam, friends. So this is very interesting. Why? Because from Sanskrit, one each syllable, if you apply one principle from each of these 9 grammars, you end up with 9 meanings. That's why there are 9 different libraries. You apply one principle from each of these libraries to understand a matra. And if a word has 2 matras, you end up with 9 to the power of 2 meanings. You essentially end up with 81 meanings for a word which has 2 syllables, friends. So uh, that's how that's why our rishis have compiled, this ancient scientists of India have compiled all their observations, scientific observations in books called Samhitas. And these Samhitas were essentially documented only in Sanskrit. Why? Because, they could, essentially write less, but communicate more, in a very profound and a very syntax-based manner. That's like the profound that's the profundity of this language, Sanskritam. That's why everyone uses this Sanskrit. I mean, at least until at least 5,000 years ago. And I was trying to apply the various principles, and when I started reading these ancient books, friends, I don't know. I mean, it really it really baffled me. You know why? Because the complexity of the human body is explained in such simple manner. For example, they were also talking about these ancient scientists of India were talking about Ashitishchatva Lakshara Samritam Swastya iti Vidhyate. What it means is there are 84 lakh chemicals found in the body, and they don't just simply mention them as chemicals, they call them as nectarine chemicals, rasa amrutam. There was also already a mention of 8.4 million chemicals that are present in our body participating as we talk. According to the modern science, we know about 700,000 chemicals only. The ancient science goes much beyond. It says there are 8.4 million chemicals. And friends, you guys are from IIT. I'm sure you would know something called as analytical chemistry. In analytical chemistry, what you do, you first find the solubility of a certain substance to essentially, structure elucidate a certain unknown compound. You need to first see in which is it soluble, then you separate it, then throw light through X-ray crystallography or, I mean, X-ray diffraction, and then, try to structure elucidate through NMR, proton NMR, carbon NMR, and several other methods that you deploy to elucidate a certain structure for which the foundation is your solubility profile. And the solubility profile of all of these 8.4 million chemicals is already documented. They said Jalaja Navalakshani, which means water soluble chemicals are 900,000. Sthavara Vimshati Lakshani, 2 million chemicals or 20 lakh chemicals are non reactive. Ghrita Chaturasya Lakshani, 400,000 chemicals are fat soluble, and so on and so forth. I mean, I can't, I mean, the complexity of this of what was already discovered and documented goes much beyond. They mentioned that, out of these 8.4 million chemicals, that they found the solubility of all of these compounds. While in the modern medicine, okay, as I said again, this is not Ayurveda versus allopathy at all, friends. Again, just reiterating. But then, it's interesting to note that, they mentioned that about 32 trillion interactions are possible among these 8.4 million chemicals. So they mention it as a Dvam Trinshan Nama Sahasra Kotya Cha Rasayanani Karshani, when they mention in certain books of ancient books of biochemistry. They mention that 32 lakh crores, which means 32 trillion interactions are happening as we talk. As we talk, during this conference or during this talk, 32 lakh interactions are actually happening, lakh crores, sorry, as we talk. And then they classified them into into 21 different libraries again. So advanced data science was already deployed, according to my understanding, at least. And then, um, uh, at least I was given to understand them. Okay, by the way, I'm talking the theory that is already present in, and then let's come to a little bit of science of how we actually try to verify this. You can write a beautiful story, but is it verifiable? Is it scientifically accepted? Is something that we need to verify always. So I'll come to that a little later, within just the next couple of minutes. But then it mentions that 21 broad. They were classified into 21 broad categories. Seven of these categories, which were based on your organoleptic properties of these chemicals, they were classified into molecular pathways. They guide the molecular pathways. Seven of them guide your metabolic pathways, and the rest of the seven organoleptic properties of among these 32 lakh interactions, they guide all your assimilative pathways, and they were classified as Vata, the Pitta, and the Kapha, friends. And then what the ancient science is saying is that when you essentially bring about a balance, which means when we mathematically put, when we Vata is to Pitta is to Kapha is 1:1:1 in all of the 7 tissues and 42 organs, then your body sets itself into a self-healing mode. Then it sets itself into self-healing mode and cures itself. So, and everything that you find, everything that you eat, everything that you think, and every thought you make, every move you make, has a certain VPK syntax, have a certain VPK proportion. And VPK is for Vata, Pitta, Kapha, respectively. So, it has a certain VPK proportion. For example, if you talk about the brinjals, all right, it has got 65% of Vata, 30% of Pitta, and 5% of Kapha, all documented already. So, and what is this? What is the prabhava? The effect of this brinjal? It increases vata in the blood. That's the syntax. There are 7 tissues in the body, and there are it says that the brinjals essentially increase vata in the blood, which means if you detect a certain individual with a vata depleted system, with a vata depleted blood system, then you essentially give brinjals so that you bring about a vata balance in that particular, or in that particular individual, and then you bring about a VPK balance in all of the 7 tissues. You choose appropriate foods, appropriate exercises, yogasanas, appropriate pranayama, breathing exercises, and all this so that you essentially bring about a VPK balance in all of the 7 tissues and 42 organs. Then the body automatically cures itself. That's what is said. So what we did was, because all this theory was really looking good, uh, but then it's theory as long as you don't prove it. And then, friends, this is exactly where I would urge each one of us to be extremely scientific. You just because you don't understand a subject, you cannot delete the topic. You cannot delete a subject. That's not right at all. If we don't agree, also let us document. Let us do experiments because ultimately, not me. But the modern science is saying, isn't it? Right? You have experimental proof, you have citations, and you have analytical proofs. Right? There are three proofs accepted. Did you know? Interestingly, Jagadguru Adi Shankaracharya, who happens to be one of the most influential spiritual leaders, you know what he taught? When he told his disciples, he said, "See, tasmat shastram pramanante karya akarya vyavasthitam." What it means is tasmat, and hence shastram pramanante. Provide me scientific evidence for doing a certain thing. You he says karya, to do a certain thing in a certain way, or akarya, to not do a certain thing in a certain way. Provide me scientific evidence. And again, our ancient science also talk. I mean, these spiritual masters also were talking about pramana. Tasma Shastram Pramana. They say talk about a pramana. What is pramana? Proof. And he talks about again three proofs: Shabda Pramana, Anumana, and Anubhava Pramana. The same three pramana that we have in the modern science, like experimental proof is for your Anubhava Pramana, the analytical proof is for your Anumana Pramana, and Shabda Pramana is your citations. All right, so we are talking about the same thing in different languages. That's the difference, actually. That's the only difference. Otherwise, even our spiritual masters are asking, if you look at Swami Vivekananda's story, Ramakrishna Paramahamsa, Swami Vivekananda verified him until his death. I mean, he was a very, I mean, see, the point I'm trying to drive here is, friends, this scientific fervor has to be present. You cannot just accept just because some doctor is saying. Ask him for a proof. Ask anyone. Even if it is God, let him prove. Because that's what they are telling. Gods are telling us. That's what rishis are being saying. That's what our scientists are saying. That's what our ancient scientists, also ancient spiritual powerful leaders were saying. So friends, this is very, very interesting because again, if you talk about religions again, Swami Vivekananda, I mean his master Swami Ramakrishna Paramahamsa, this is a slight detour, friends, but this is very, very important in building your character as entrepreneurs. Because what we tend to forget is that scientific evidence of whatever we're doing. Is it scientific? Is it truthful? Are we honest enough? Look at what Swami Ramakrishna Paramahamsa does. Because, okay, why am I talking about these gurus? Is because they were real original inventors, and that is a true innovation of India, isn't it? Swami Vivekananda, when he talks about India in the Chicago, the Parliament of Religions, he says India is a country where you know uh, spirituality is the undercurrent of India. If spirituality is gone, there's no India left. That's what he says. So that's why I try to derive all these, lessons from the gurus and verified this science, and then put it to the Westerners, and then you'll see what happened very soon, as I go into the final part of the discussion. So Swami Vivekananda, Swami Ramakrishna Paramahamsa, look at what he did. He exactly followed what the 10 Commandments of Bible, and then he demonstrated. He had this as explained in Bible. He had the vision of Lord Jesus Christ. The same he applied for understanding Quran. He followed the tenets of Quran, and he had this Nirakari Allah's vision. And that's verified by the spiritual leaders of those times. That's why he was attributed by 18 kalas of avatarhood, and then he was accepted as an avatar by Ramakrishna Paramahamsa was accepted as an avatar. So that's why I'm saying, scientific reasoning and scientific proof is very, very important. So that's why we went on to prove Vata, Pitta, Kapha with the scientific, correlation. We did some scientific correlation of Vata, Pitta, Kapha. We modeled Vata, Pitta, and Kapha with the in experimental animals by creating animal models of Vata, Pitta, and Kapha. And how did we do that? Very simple, because the syntax is already given. The Vata aggravating foods, Pitta aggravating foods, and Kapha aggravating foods were identified from again the scriptures, because the scriptures were already were talking about the VPK fingerprint of each of the foods that you have. I just mentioned about it. And then we gave these animals a vata, pitta, and kapha aggravating foods in three different groups respectively. And after for a month, and again, why for a month is again a part of the method that we arrived and after reading the scriptures extensively. What we found, friends, after that we isolated the hearts and we measured their action potentials. Anyone do biomedical engineering or you would understand when we develop sensors. Sensors are essentially we try to understand neurophysiology to develop biomedical sensors. So PPG, for example, sensors are pretty much are used for pressure actuation. They're very good at for pressure actuation, and then we use it in identifying your blood pressures and several other parameters. Now PPG sensors are the ones that are used even in your watches that measure heart rate variability. So we used some sensors, we used glass electrodes, and we used optic mapping system to measure the electric currents generated in Vata, Pitta, and Kapha. Because when I'm talking to you, while I'm talking to you, how are you able to hear me? The sound is incident on your tympanic membrane. The tympanic membrane transmits the sound waves into a mechanical wave. The mechanical wave converts into an electrochemical message inside the auditory receptor. It converts into electric current essentially, and then the current goes to the brain analyzes the centers, brain centers analyze the information and then send back a response. The same thing happens when someone touches you there's something called the touch receptor or the tactile Pacini's receptors. They convert your external touch into an electric current. Friends, what we found was the vata, the pitta, and kapha were altering the way the currents were produced. That is a primary difference. That is why our rishis were talking about these three agents called Vata, Pitta, and Kapha. That was so vivid, it was like, not only were we able to, find differences in the way the electric currents are generated, but also several of these experiments demonstrated, validated the properties attributed to Vata, Pitta, Kapha. For example, Vata, what happens in Vata is, okay, when an electric current is generated. Initially, when the cell is resting, there's something called as a resting membrane potential. All right. So when an external, let me just quickly show a slide if I'm allowed to. It'll be visible. Is that okay?
Yeah, yes, sir.
You're able to see my screen, right?
Yeah.
So let me just show you. Okay, there's something called action potential. The resting membrane potential was minus 60. I mean, threshold membrane potential was minus 65. What happens is when a cell rests, the resting membrane potential is around, minus 84. That was found in the control group of rats. In the Vata, the resting membrane potential was minus 72. And the significance of the threshold membrane potential is that, until and unless the external current is so uh, strong enough to breach the threshold membrane potential, it doesn't get packaged into this action potential, which is a packaged, version of your external stimulus. All right. So what we found was, interestingly, the resting membrane was minus 72 for Vata, minus 90 for Pitta, and minus 108 for Kapha, enhanced diet-fed rat groups of, diet-fed rats. What it means is the difference between the resting and the threshold is the external stimulus equivalent, which means for Vata, the external stimulus should be around 7 or more millivolts. For the Pitta systems, it should be 25 millivolts or more. The Kapha system should be 43 millivolts or more, which means they require different strengths of external stimulus to elicit an action, to perceive the information. If this is understood, then it is going to be very interesting, because the Vata, what it does is, if you give an external millivolts, external stimulus of 53 millivolts across all the systems, Vata systems would produce 7 action potentials. 7 responses, Pitta would produce 2 and Kapha would produce only 1. So this is very important. Why? Because it has validated what is present in our books, actually, in the ancient books. Because the difference between the resting membrane and the threshold in Vata is only 7, and hence the tissues in Sanskritam were called as Chalatva, or tissues or systems having a property called Chalatva. And in Kapha, they were called as Sthira. Why are the systems Sthira? Because there was a wide gap between the RMP and the TMP, threshold membrane potential. And then for these systems to get into, convert the external stimulus into an action potential, they required a larger stimulus, and hence they were stabler for lower stimuli, external stimuli. This is very, very interesting because it was the first time that anyone actually had developed a model of Vata, Pitta, Kapha and experimental animals. And from there, we generated a lot of data, friends. And how does it translate now? It translates interestingly into a certain concept. I'll quickly tell this because, from here uh, lies all the answers for the questions that we had, when we started off with this venture. What it means is, the way the Vata tissues produce 7 action potentials for the same external stimulus of 53 millivolts means that these tissues are hyperexcitable, which means their tissues are using up energy faster. And Pitta systems were actually burning up glucose faster, producing more energy. But because they were burning up more glucose, they were producing more energy, and their dependence on glucose was higher. And hence the body was resetting its blood glucose levels to higher levels, and which should not be considered as pitta, which should not be considered as diabetes, friends. The kapha systems were actually, required a larger external stimulus, and hence so they were relatively stabler, and hence were sluggish in their response. See, the external stimulus was the same, but the way the tissues got stabilized led to the way they metabolize your glucose and cholesterol, and hence your glucose and cholesterol concentrations in the blood are nothing but a a function, a mathematical function of the quantities of Vata, Pitta, Kapha in individual tissues. That's why, we were able to come up with something very interesting that I call it as a VPK fingerprinting, for which we have, a certain mathematical formula to which we arrived at, and hence your Vata pacifying diet, or Pitta pacifying diet, or Kapha pacifying diet will be different, because the way they metabolize glucose and cholesterols are different, and hence you'll have different standards when you're dealing with different people. And this is the solution that we are actually proposing to the world. The metabolic fingerprint, I call the VPK fingerprint. VPK fingerprint is the proportions of Vata, Pitta, and Kapha in individual organs of an individual, and that which translates into the way the body metabolizes your glucose and cholesterol, and hence your dependence on these two important chemicals, and the sources from which these the chemicals originate in different individuals are different, and hence different foods are required for different individuals. And you see, everything has to be personalized. For example, if someone has aggravated pitta, you cannot ask him to do a bhastrika, because bhastrika aggravates pitta. This is not what I invented, but the Bhastrika is a form of yogasana, pranayama, a breathing exercise in which it aggravates pitta. And if someone has got pitta aggravation in his system, for him Bhastrika is contraindicated. So that's how we slowly, converted the entire algorithm into a BPK fingerprint based algorithm that now, we translated all this into, the language of modern science, and we identified more than 3,000 markers for VPK quantification. And we were talking about, in the beginning of this, I was saying that about, if the 3 doshas are brought into a state of balance, and the body automatically cures. You know what? We did experiments to demonstrate how total regeneration of the heart is possible. In a heart attack model, we created heart attacks in experimental animals, and demonstrated how heart attacks can be cured. Not only cured, but dead portions of the heart when heart is subjected to a heart attack, can be regenerated. Dead portions of brain can be regenerated. Kidneys, liver, pancreas, you name it, we did it. So more than 22 years of research, friends, this is slightly older slide, I'm sorry. But then 63, when we talk about 63% of success rate, we're talking about we recruit in our, now comes to the we'll come to the regulatory framework. We chose to treat only the end stage patients. Why? Because, you should refute, as I talked earlier, that, you should refute scientific data with scientific evidence. So our data, when we begin, we didn't have much data, isn't it? We had scientific experiments that we did in experimental animals. Definitely, we had a very strong scientific logic, but then we didn't have the data mapping. For example, as of today, not as of today, as of 2014, more than 180 million patients got operated in a certain operation called as a bypass surgery, for which, when there's a heart attack, when the blood vessels in the heart are blocked, you do something called as a CABG surgery. And then, the bypass is, how many grafts were done? 420 million grafts done over the past 70 years. Our data of just 10 or 20 rats data cannot match the data based on statistics, isn't it? Statistics is a science, of course. We have to respect it, and we have to go according to the current contemporary science. So we didn't have much data. So we started off doing this, offering these treatments of, VPK balancing through VPK fingerprinting to end stage patients, to palliative patients, end stage, geriatric care, hospice care patients. And I'm talking about success in those patients. 63% of our end stage patients who were given to live only 2 to 6 months of time, you know what? They're living for more than 5 years with a 63% success, in which means they are free from all drugs, who otherwise were supposed to be dying in the next 2 to 9 months. They are living for more than 63, more than 5 years, and 63% of these people are free from all drugs. There's a quick, our methodology, we come up with with guidelines as to how to deploy this. I call this as polyscientific Ayurveda. That's what is the short abbreviated version of PSA. We don't violate any guidelines issued by scientific congresses. This is how we are protecting ourselves, and also telling the scientific communities across the world that we are completely scientific people and will not violate the guidelines given, just because we don't have statistically significant data to match our data with the one that is already presented by different congresses. And then as a policy, because of this, we are having to deal with only the end stage diseases, because legally, and based on the regulatory framework of any country, you can offer your offer your treatment to end stage diseased patients or functional cases, when doctors have given up. So that's how we slowly overcome the regulatory frameworks problems as well. Because, whatever you postulate from India has to be acceptable to any guideline, any scientific congress across the world. Just because a set of people believe that you're wrong, you cannot, discard your treatment option, or you cannot essentially abandon a certain theory that is already propagated. A theory or a scientific postulate should be balanced only with the scientific data, friends. That's very, very important. Throughout my career, throughout my, our entrepreneurial journey, we stuck to this, and then really, we were able to collaborate with the patient's GPs through this method. Because when you go with the scientific standards, friends, because scientific standards, and peer review, what happens is those scientific people are willing to collaborate with you. That's really the beauty, of our approach. It has helped us collaborate with several patient GPs. Initially in our SWOT analysis, I prepared that, allopathic doctors and government's regulatory framework would be the threats. You know what happened? By this approach, actually, the government regulatory framework outside of India was really very good. They really readily helped us. I tell you, last 1 year, the European, in the UK Parliament has invited me thrice to actually help them adapt this particular technology to their NHS. I was invited thrice in the last 1 year. And now on the 6th of March, I'm again speaking to the European Union. They have invited me as a vice chair for their medical devices, friends. And this is what happens when you are completely scientific and you're steadfast and very honest in your approach, friends. This is very important. So, with this five-pronged treatment approach of polyscientific Ayurveda, in which we give all natural supplements. Okay, we're not again. Uh, uh, Two things are very important that I felt was when you talk about Ayurveda, two things come in. Number one is the legacy that you carry with Ayurveda, the legacy of of this science being in existence and helping millions and millions of people over the last at least several thousands of years. Number one. But then in the current form of Ayurveda, you know what is happening, friends? Ayurveda is actually reduced or practiced as herbal allopathy. People are not following this. And from my experience and from what I see is if you talk to any practitioner, if you ask, sir, can you quantify my doshas in individual organs? They will not be able to tell you. Why? Because no one has modeled Vata, Pitta, and Kapha. Of course, there are certain devices coming in. We'll talk quickly about them a little later. Or we don't have much time, but then we started 5 minutes late, so I'll take 5 minutes more beyond 9 o'clock. But I'll take some questions as well. Just give me 5 minutes to end this, and then we'll take those questions. So,
Sure, sir.
yeah. So what is happening is people are actually thinking that herbal medicine is Ayurveda. Friends, no, that is not Ayurveda at all. Not Ayurveda, not Chinese medicine, not homeopathy, because talk about Chinese medicine, there are three agents are called as the Shi, the Gu, and the Qin. In homeopathy, they call it the air, bile, and the mucus. In the Avicenna's medicine, they call it the Shafra, Balgam, and Dam. See, all these warring civilizations, they agreed on one thing, that the body is governed by these three different agents, and they called as Vata, Pitta, Kapha in their respective languages, and then they agreed on this. But the key here is to identify these imbalances in all of the seven tissues and 42 organs. And then to bring about that, you've got to measure them, you've got to quantify them, because there are several differences in the way the textbook versions of these Vata Pitta Kapha presentations in those individuals of those times, because the books were documented those times. In those days, the not the Bhartru, the Ashtanga Hridayam, the Vagbhata's Ashtanga Hridayam, which is a book again on Ayurveda, he mentions clearly that there are Vata dominant people. There are 25% of Vata dominant people, 25 Pitta dominant, and 25 Kapha dominant people. And then, only 3 to 5% are mixed. Vata, Pitta, Kaphas are mixed in only 3 to 5%. But that was the data database of the demographics of the populations of those times. They're being now applied in the current populations. And we are trying to find those Vata dominant, Pitta, and Kapha dominant people, which you will not find. Because in our research, we discovered that 75% of individuals have all of these three doshas in different organs differently. So there are Vata, Pitta, Kapha dominant people are about 75% of people, and different organs have different VPK fingerprinting. So all the more the necessity to quantify the Vata, Pitta, Kapha in different organs becomes essential, number one, and using a certain algorithm to bring about a VPK balance in different tissues of the same individual and different organs of the same individual it keeps dynamically changing depending on which tissue are you targeting. And hence, we came up with this entire methodology of VPK fingerprinting. And based on this VPK fingerprinting, you essentially give appropriate diets for that individual at that particular point of time. And it keeps changing, depending on, the time of the treatment and several other factors. So you map the specific yogasanas, the specific workouts, specific pranayama, breathing exercises, and what did we achieve, friends? There's an IDDM patient. Look at this. There's a anti-insulin antibody which was around over 2,100. The anti-GAD antibody was around 48 in a 4-year-old male who was diagnosed as already was being treated as IDDM patient. Who was getting 60 units of insulin at the age of 4, and we did pulse diagnosis, and we figured that he's a Vata aggravated Vikriti. After treating this patient with, high glycemic indexed foods, We gave him literally foods with high, conversion of glycemic index. And because vata requires that kind of foods, high glycemic index foods and high saturated fats. Saturated fats are supposed to be bad, right? But that's not the case, friends. That's not always the case. So after 2 years, 2.2 years, we were able to, see the levels of anti-insulin antibodies coming down to 195 and 8.76 anti-GAD antibodies, and we were able to reduce his insulin to 4 units, friends. That's it. From 60, he came down to 4 to 6 units per day. There's several heart disease patients, friend. On the left, this is the block that we found. You find on the right, it is gone after 6 months of our treatment. There's another pitta-mediated heart disease patients. There's several patients, heart disease patients. You see, this is the block that is found. The block slowly goes away. The block completely goes away after 6 months. Several, I mean, what I'm trying to say is we treated several end-stage patients. This is psoriasis. For 20 years, he suffered with psoriasis all over the body. His kidneys failed. He was on dialysis for 7 years. And before he came to me, 9 months after the treatment, he was completely normal. We stopped his dialysis after 18 months of our treatment. And several end-stage cancers. This is a brain dead patient, friends. Brain dead, 23-year-old brain dead patient. This is a completely necrotic brain that you find here. On the right, you find the brain is developed after 6 months. This girl slowly improved her memory, and then it's wonderful miracles could be scientifically demonstrated in several end-stage patients. Vitiligo completely gone. Crohn's disease on the left, Crohn's disease on the right, completely gone. Several patients, friends, allergies, asthmas, you name all types of end-stage diseases were cured. And we generated patients' data. I mean, it took, the point I'm trying to definitely drive here is, it took more than 22 years for us to, more than 32 years, of course, from the beginning of the idea, but 22 years for us to do research and put in more than 150 man-years of research to translate this knowledge into an accepted scientific and clinical methodology and demonstrate the efficacy, friends. And based on this, we filed for several patents, 58 patentable technologies were identified. And then, we came up with certain, most of you, or if not, at least some of you would have, heard about the heart rate variability algorithm. So in my research, we were able to model Vata, Pitta, Kapha, not only them, but also their subtypes in experimental animals. And from there, generated the frequency domains for heart rate variability. And from there, I developed an entire algorithm. Through the course, I had to learn Python. I learned data science. I'm a data scientist as well from the University of Texas, friends, and apart from being a pediatric cardiac surgeon. And this really helped me because I then figured out that there was none of my kind, actually, a doctor and a data scientist and a Python programmer. So all in one. So today's Fitbit is developed by engineers, but there's no doctor there, actually. So I now know if what is that called? Theranos. If that lady would have approached me, I would have told her how it is possible and how she could have come up with a microchip that would have, she already made billions, but unfortunately she's in the jail right now, the Theranos. But it is possible, friends. And that's why, I knew that this was possible because I exactly know what is happening. When you are able to identify the VPK fingerprint of an individual, you exactly know what is happening inside the cells, because what is happening inside the cells is completely, behind the Iron Curtain, just like, the Russians were behind the Iron Curtain during communistic regime. It's completely behind the Iron Curtain. You can only estimate, but with the VPK 4042 algorithm that I created, I come up with a rough estimate of what is happening inside the cell. From there, I came up with a module in which you can give your blood biochemistry. That's exactly what I call it as a omics tracker, friends. It was an interesting cruise of journey last 32 years. The point is that this ancient science of Ayurveda is extremely complicated and a very, very complex algorithm, friends. So for which, a lot of work was done. And when you do it scientifically, friends, what happens? We just recently presented our technology in the CES 2024 Las Vegas show. It was a super hit, friends, and then we're still, I don't want to open up much about the what happened during the Congress and then after that, but you'll hear it very soon from the news possibly. But then it was an interesting cruise of how we were able to, convince the world's most powerful, FDA, which is the US FDA. We're working with them right now. And then we're working with some of the peer-reviewed, peer institutions across the world, like the MITs and Johns Hopkins. And they're not just convinced, but they want this science quickly absorbed into their universities and then, give them a direction as to how to approach the problem of health. You know what? See, in the US, there is a big problem, friends. See, the problem is, of course, their healthcare market is over 4 trillion, right? The several pharmaceutical companies working in that. But then if you look at the improved clinical outcomes, the clinical outcomes are really, the quality of life is really not that great. So they need a solution, friends. When you work on the improvement of quality of life, or when you work on a certain important problem, and you apply all scientific postulates, currently acceptable scientific postulates, because science doesn't change over time. F is equal to ma will remain F is equal to ma, whether you call it as vega nimitta visheshat karmano jayate in the Jaiminis or the Varahamiras Samhita, or you call it as, every body continues in a state of rest or of uniform motion in a straight line until unless acted upon by an external force. The postulates don't change, friends. But then your uh, your ability to connect these dots and then to be able to communicate in the language of science and to be able to not breach those maryadas of scientific validations, then you will be more accepted, friends. None of these regulatory frameworks would come to stop you, because what stops me is what stops us here today: the dogmas. The Ayurvedic doctors say, "Doctor, you're a cardiac surgeon. We cannot accept you because you're a cardiac surgeon." Is that a problem, friends? See, you know why? Where are those dogmas coming in? Those dogmas coming in because people, some sections of people don't want to be scientific. And science doesn't mean that you're trying to verify everything. Yes, you need to give some logic, and definitely a scientific founding, a logical sequence of where you're coming from. How are you applying a certain solution to a problem? Is it scientific? Is it repeatable? Is it peer reviewed? And when you do this, friends, as I mentioned in the middle of my talk, that those sections of communities that I thought the government, the regulatory framework, the allopathic doctors, who I thought would be our, deterrents, what? We made friends with them. They become your friends, and then they actually promote you, because whatever is scientific will be accepted across the world, friends. This is what was my a quick. This is what I thought. As youngsters, you should know that steadfastness, honestly sticking to the principle that you started from, and sticking to scientific fundamentals will really get you where you really want to be. But this is just जैसे ओम शांति ओम में शाहरुख खान कहते हैं कि अभी पिक्चर बाकी है. So the picture अभी बाकी है, क्योंकि this is a technology developed to target $1.2 trillion market, and we have come up with an entire automatable, scalable version of this particular health delivery system. And very soon, it'll see light in the face of several, at least hundreds of thousands of doctors, who will take this further to serve the needs of their end stage patients, and through which I'm assuming that Ayurveda will get mainstream, friends. This is where I land. If you have any questions, I'd love to take them. So everyone understood everything.
Sir, there's a question in the chat box.
Oh, yeah. Oh, sorry, I didn't see that.
Yeah.
There is one here. Yeah. Yeah. So, Mr. Raghav Gopal, yeah, good question. Yeah, definitely yes. These three fingers, the index, the third finger, and the ring fingers are applied on the radial artery. You have a artery here exactly, and then you put these three fingers on the radial artery in this consequence. Your right hand is put on the left hand of the patient, left hand on the right hand of the patient. So, with which uh, we have evolved this technique. I mean, we have rediscovered this technique after reading some of the books called Vaishajya Ratnavali and all. Um, there's several verses mentioned in these ancient books. Um, how do you measure? There are certain pulse characteristics mentioned already in our text. Like Vata is characterized by something called as a slippery pulse. There's something called as Sarpagati, it's called as Sarpagati. Pitta is characterized by a Manduka Gati or a bounding pulse. And Kapha is characterized by Hamsa Gati or Swan-like or a sluggish pulse. So how is it, how do you apply this? When you apply, when you use these three fingers, apply on the radial artery and apply differential pressures at 7 different levels. You take the superficial most pulse without applying any pressure, just on the surface of this particular artery, just when you touch the artery. And then you go all the way down deep to the level where you obliterate the pulse. And from there, divide this distance into 7 different levels. You end up with 7 essentially different layers of pulse through pressure actuation. And with these three fingers, you end up with 7 into 3, 21 data points on the left hand and 21 data points on the right hand. Each pressure point or data point corresponds to one organ in the body. So that's how you end up with data coming in from 42 different organs. And depending on the pulse pressure characteristic, just like I said, Vata, if the pulse has low amplitude, it's got a sharp curve. And if the distance between the dicrotic notch is too low, then you call it as a Vata pulse. And depending on the components of the Vata pulse, Pitta, and Kapha pulse, the pressures, the pulse percentages of these three different pulses, you arrive at pulse percentages of these three different doshas in those particular organs. That's how you essentially detect the pulse pressure characteristics, or that's how you do pulse diagnosis. That's what I picked up, and that's what I use routinely in our clinic, in our hospital. And when a patient comes to me, I essentially do his Nadi Pariksha, and through the Nadi Pariksha, we pretty much, give almost a certain rough estimate of your blood biochemistry. So that's completely new. And that I translated into an entire mathematical algorithm. And again, what is the rationale behind? Is there a scientific rationale? Yes, friends. The rationale is when the blood flows in your arteries, it is not flowing as a single stream. It's called Guyton's physiology. Reference is given in circulatory physiology, chapter 33. Guyton's physiology clearly mentions that the blood flows in 3 different laminae. It means, that viscosity, when there is because the blood has certain viscosity, viscous fluids, stick to the, container, and hence the velocity at the rim would be lower, and the central stream would have a higher velocity. So similarly, the blood would have, from the Guyton's physiology itself, we figured that there are 3 different laminae, but then applied advanced, Röntgen and also Raman spectroscopic methods, we did these experiments, we figured that there are 7 layers in which the blood flows, which means there's 7 different sets of, one condition is that the patient should be rested well for these laminar flow to resume. Otherwise, the turbulence will actually, vitiate all these laminae, so you will not see the laminae. So patient should be rested well, and when you allow that to happen, when you allow the patient to settle down, you essentially have the 7 laminae, and each lamina our suspicion was that each lamina corresponds to each tissue as explained in Ayurveda. Ayurveda talks about 7 different tissues. So these are not physiological. I mean, these are physiological tissues and not anatomical tissues. So it's really interesting. They classified the ancient scientists. Or the physiologists of Ayurveda classified them into the body into 7 different tissues. They're called as the rasa, rakta, mamsa, meda, asti, majja, and shukra. They're called as a dhatu. So you get the information of 7 different tissues through Nadi Pariksha and are able to quantify these doshas. So this is pretty much a dying technique, essentially. No one does that uh, because it's very complicated, friends. And without my understanding of basic organic, inorganic chemistry, stoichiometry, electrical equations, and buffer solutions, I wouldn't have made up. I wouldn't have understood what our ancient scientists were saying. I think the fundamental and then the secular sciences are very, very important. And by the way, this is not secular, or I mean, I'm not talking in the sense that secular or not, but then these sciences find a mention in our Samhitas as well, friends. No one teaches Agastya Samhita. Agastya Samhita, which is talks about a lot of chemistry, is not taught as a part of the Ayurvedic curriculum. So that's why this the knowledge of chemistry is lost, and hence how to translate this language into the language of, I mean, the language of Ayurveda into the language of modern science is lost, unfortunately. And that's the gap we tried to bridge, and to a great extent we were able to bridge. And when that's why till at least 2 weeks ago, the position of the US FDA, at least officially, even though officially the position is the same, that they say Ayurveda is not a science. But then when I talk to these guys, these guys at the US FDA at the top level, they said, Dr. Polisetty, this looks really compelling. We will want to further look into whatever data you generated, friend. So uh, uh, this was possible again through scientific experimentation, and to a great extent. I mean, we're still in the process of making it, but we were able to demonstrate our product. And when people look at by just this HRV algorithm, friends, I'm able to give your blood biochemistry. That was really uh, uh, we give your HbA1c, your blood glucose, your lipid profile, completely non-invasively, without taking any speck of blood. We are running a clinical trial now. As I said, whatever is not scientific, we will not present. So we're doing a clinical trial now. Once it is done, the whole world will know about this technology, friends.
So if anyone has any other questions, feel free to ask. You can ask either directly or you can also write down in the chat box. Okay, I'm assuming there are no more questions.
Okay, so let me go forward. So as you have said that the level of lipid profile, the cholesterols and others were increasing. So does Ayurveda come with a solution to it? And like how long will it take, or it has some of the solutions right now?
Yeah, that's exactly. See, Ayurveda, as I said, doesn't uh, give the solutions in a platter. We were able to figure them out through our experimentations. I'll explain a little bit. See, from our experiments, what I just showed you, that the vata, the pitta, and kapha are actually leading to a certain way in which the glucose is utilized in the body. For example, vata makes the tissues hyperexcitable, and when a tissue is hyperexcitable, it is using up energy faster. So these are systems that are energy depleted. And in the body, energy is derived only from your glucose, blood glucose. I mean, the glucose, I mean, the carbs that you eat burn down are digested into your glucoses, your lactose, galactose, several sugars. galactose, aldose, triose, tetroses, pentoses, hexoses, septoses, and so on and so forth. They get into the blood, and then only one of these molecules, among all of these molecules, which is the glucose, enters into the cell, enters into a certain system called as the mitochondrial system, and burns down there. That's what it's called as glucose combustion, and leads to the formation of energy from there. So when vata makes the tissues hyperexcitable, the tissues use up energy faster, and hence are energy dependent, and which means they are glucose dependent as well. If you don't give enough glucose in such individuals, or to such systems, the body then, what, it triggers something called as a gluconeogenesis. What it means is the body burns up your fats. Fats are the second fuels that you all must have already known. Second fuel, if there are less carbs in the body, there are less glucose in the blood, the body burns down your glucose, fats, to produce glucose in a process called gluconeogenesis. Gluco is glucose. Neo means new. Genesis is the new way of producing glucose. So which means when you have vata, when you have aggravated vata, the body needs more of these fats. That's what it says, right? So it doesn't give you a direct solution, but then understanding your vata metabolism in the language of modern science will give you an idea as to how much of LDL is required in an individual. If an individual has more vata, he needs more LDL. If an individual have more pitta, then he needs more LDLs and also more triglycerides. If a person has more kapha, or a system has more kapha, then you need more HDL, friends. So you see, the good cholesterol is good only for kapha individuals. The bad cholesterol is good for vata-based individuals. And again, as I said, you don't have a clear-cut vata or a pitta or a kapha dominant individual. To quantify your blood glucose, which LDL and HDL value is good for you, you need to quantify the VPK again, individual organs, because VPKs are the ones that are guiding your glucose metabolic pathways. There are more than 175 of them. And then there are fatty acid pathways again. In today's world, what is happening? We think all the disasters are because of LDL, and we're trying to restrict LDLs with the help of certain drugs called as statins. And what is happening now? Hunt, again, a researcher from Norway, he has come up with a detailed report on how statins were used. He had gathered data from about 92,000 patients who had been on statins for more than 15 years. And what he found? 49% of these people who had statins had either a new form of a heart failure, or early onset of dementia, or Alzheimer's, or liver failure, or a kidney failure, or rhabdomyolysis, or what it means is 49% of them have developed serious forms of very debilitating disease conditions. Why? And then he presents it in his 92,000 page report, friends. So the point is that definitely by understanding Ayurveda in the modern scientific way, we are able to essentially come up with a solution for the world's biggest menaces, which is the blood glucose and also lipid profile, friends. And that's what I wanted to make. But as I said, it's a long journey, because we need to go into the nitty-gritties of the glucose ergonomics, the cholesterol ergonomics, and then understand more deeply. But I think suffice to say that yes, we were able to come up with give a solution to this, and then through which we were able to reverse diseases. That's the beauty of it. We were able to reverse diabetes. We were able to, as I showed, I was able to demonstrate how by giving saturated fatty acids in a vata-mediated heart disease, we were able to reverse his heart disease. See, that means, we were able to provide solutions to current day problems, to some extent, at least, I could definitely claim, because we have data for that.
So, yes, thank you, sir.
Thank you very much for asking this wonderful question.
And I'm Rupok Banerjee, and thank you everyone for your engaging questions and for actively participating in today's session. We truly appreciate your efforts and curiosity and enthusiasm. And thank you, Mr. Ravi Shankar Polisetty, Dr. Ravi Shankar Polisetty, for sharing valuable insights and expertise. Hoping to see you on campus for an offline session really soon. And as we wrap today's session, I encourage you to stay connected and continue the conversation and surely connect with Dr. Ravi Shankar Polisetty on LinkedIn as